Well, good morning, everyone, and welcome into Community Conversations. We're glad that you're here. I am your host and facilitator, Orlando Williams, Chief Executive and Equity Officer of Motus Recruiting and Staffing and Motus Technology Solutions. And this morning, we are excited to have a conversation and bring you our topic, prioritizing health in our communities. And it is a pleasure to also partner with the Portland Trailblazers in this meaningful work in an effort to bring Oregon together as a community. And this morning, I am incredibly honored and excited to have with me as my guest the incomparable Dr. William Johnson, the president of Moda Health. Dr. Johnson, how are you this morning?
I am doing just great. Thank you so much. I appreciate you inviting me to be on.
Well, it is absolutely a pleasure. I know, we've had our paths have crossed many times, and we've had an opportunity to share some meals together and some events together. And I have to admit, I really just am a huge fan of yours, of your leadership. And so this is really great. I'm excited that we get a chance to have some time together and that you were able to take time out of your day.
Well, I'm a true fan of yours as well. So again, thank you so much. This is great.
So what I thought we would do is I want to make sure that we get an opportunity to get to know you. But before we dive into a Q&A, I want to let our audience know a little bit about your background so they can get to know you as well. So I'm going to share just a little bit of information about where you've been and what you've done at this point in your career. So as I mentioned, you are the president of Moda Health, and you joined Moda in 2008, and you were named the president of Moda in 2013, where you provide leadership for Moda's healthcare services in the department, which includes provider contracting and relations, medical management, population health, medical informatics, and Moda Health quality programs. You also lead the innovative healthcare engagement and ACO strategies for Moda and provide oversight to marketing and branding. Prior to joining Moda Health, you were in private practice for more than 12 years as a general and thoracic and vascular surgeon, which is absolutely outstanding. In addition to that, you served as a fellow in cardiovascular surgery at Beth Israel Hospital, Harvard University, and as an affiliate professor of surgery at our very own Oregon Health Sciences University. You currently serve on the Trailblazers Executive Advisory Board, the Nature Conservancy, the Foundation for Medical Excellence, and the REACH program, which is Reaching and Empowering All People. And you're on the board of directors there. And you also co-chair the Oregon Health Leadership Council Board of Directors. So you are very busy, Dr. Johnson. Those are a lot of great things that you're a part of.
It does require a lot of time and organization to do all those things, but all of those organizations are very, very important, and I'm very passionate about all of them.
Well, that brings me kind of to the first question that I wanted to ask you about. So I've known that you have been given the nickname Superman. Okay, so now I know there's got to be a story behind how you got the nickname Superman. So tell us about how that came about.
That's interesting that you should bring that up. It sort of started as a joke, and it was during my residency and my surgical training, and then when I came to Portland and was training. As you know, it takes a lot of time and commitment and energy to do all these things. And so one day I came into my office. This was when I was in practice. And on my desk was this figurine of Superman. And there was this Superman insignia ring. And I looked at it and I sort of laughed. And so I went out front and I said, well, where'd this stuff come from? And they said, well, you're Superman because we don't understand how you can operate at 5 or 6 different hospitals, run clinic and go back and forth and do all these things. And I go, wow, that's an honor. And they said one time they heard me say, boy, you're looking tired. And I said, well, there must be kryptonite in this room. So I think it sort of came from that. But the funny thing is you fast forward, and when I came here to ODS at the time, and then Moda, the staff that I worked with thought the same thing. And one day I came into my office, and on my desk were a pair of Superman cufflinks. And so in honor of the team, I would always wear those when I was speaking publicly or in a serious, intense meeting. And it was always a great conversation breaker. So I didn't wear my Superman cufflinks today, but that's sort of where that came from.
That is amazing. I was going to ask you if you had them on today, but it's good to know. So you're more in the, you're still Superman, but you're more in the Clark Kent mode.
I'm more in the Clark Kent mode. There you go. Glasses and everything.
All right. Very good. Very good. Well, that's incredible. Thank you for sharing that. So as were growing up and you were deciding, as most young people do, what fields you wanted to tackle or be a part of, I'm curious to know if you could share with us how you chose the medical field. What was it that allowed you or inspired you to go in that direction?
The interesting thing about that is oftentimes physicians who go into medical school, they have either family members who were doctors or they've had experience with physicians. And from my perspective, I did not. In fact, growing up, I'd never met a physician of color, African-American, Latinx, or otherwise. And so that was never even a goal of mine. And in fact, I was the first generation child to actually go to college across both of my sides, my family. But how I ended up going down that path was I wanted to work in a lab, and I loved biology. I love the science, and so what I did when I applied to USC, I went in as a biology major, and the assumption is, which is interesting, is that whenever someone comes in as a biology major, is that they're pre-med. So I start getting all these pre-med information. And the summer before I started my freshman year, I was asked if I wanted to be a part of what's called the Health Education Pre-Professional Program. And I thought, wow, okay, that would be interesting. And I volunteered at the LA County Children's Hospital. And I got a chance to meet some amazing, dynamic Black doctors. And at that moment, I knew that this was the field that I wanted to go into. And I had the opportunity to work with kids. And that was just great to me. And so then I fast forward to 1983, and I went to Harvard during the summer, and I volunteered at the Brigham and Women's Hospital. And then also did some more work around healthcare. And so from that point on, I knew I wanted to go down the path of becoming a doctor.
So being the first, and you mentioned just in your family to go to college, so it wasn't that you just were satisfied with going to college. You decided to pursue a profession that takes a considerable amount of education and commitment. Was there any added pressure in your family or in your community once you had made that designation personally? Did you feel that? Was there any other communications around your career choice at that time?
No, it was very much so focused on support and wow, this is amazing that you would do that. Now, of course, I would internalize it, and I did feel an immense amount of pressure to ultimately fulfill and succeed and keep going down that path. But I would say that was just pressure brought on by myself. But I didn't receive any pressure from others. It was very, very supportive from that perspective.
So after you were practicing in the medical field for so long and having such a successful career as a surgeon, you decide to make a career shift and run a health plan. How did that decision happen? How did you go about that process?
Well, that's an interesting story because during my surgical training, that's where I met my current wife, who's also a physician. We can maybe talk about that a little later on. But so as I was practicing surgery, ODS actually reached out. They have these various committees, the Quality Council and Credentialing Committee, and they use physicians in the community to come on board and be a part of that. And so that's what was my initial introduction into the health insurance world. And so as the company began to expand and grow, they then approached me to become a medical director here. And so I said, wow, for me to not do surgery anymore and then to go down the path of becoming a medical director, I thought, okay, let me think about this. And so I remember going home and telling my wife that I'm thinking about switching careers. And although at the time I was only going to do it for 1 or 2 years and see how it goes. And I said to her, well, I think I'm going to join a health insurance company, and go on and pursue a master's in business at the same time. And she looked at me over her glasses like she does, and she didn't say a word, deadpan silence. And so I took that as, okay, maybe that wasn't what she wanted to hear. But about a week later, when she decided to talk to me again and let me back, I stopped sleeping on the couch. And she said, you know what? I understand this is a passionate to you. And during my 12-year career, I had probably operated on more than 4,000 Oregonians who had various cancer and vascular problems and issues. And what I wanted to do is really focus on having an impact on a much larger population, whether that be from a policy perspective or joining other boards, and really impact community health and population health. Even though operating on individuals one at a time was incredibly gratifying. So she understood, and then so from that point on, I came on full board, and I have never looked back. And it was, I believe, my training, my surgical training, my career as a practicing surgeon has really helped me develop and grow in the role that I'm in today.
Oh, that's phenomenal. That connection to the community, making that transition, that there's definitely a bridge there that you can see. It's definitely salient. So from the component of wanting to help more people, to have a broader perspective, and you mentioned that as a surgeon you were able to help individuals. Is that part of just your approach and how you show up in the community, is wanting to give back to the broader community as a whole? And does that kind of motivate or drive your decision-making processes while you're leading Moda?
Absolutely, that's spot on. And every day I think of ways that we can improve the health and well-being of the community, of all Oregonians. And that is something that I'm very passionate about. And in everything that I do or think about, or every policy that I'm involved in, or every program that we create, I'm always thinking about how does it impact the community? How does it impact an individual? And sometimes when we're in a room and there's an empty chair, I think about who's in that empty chair and what is it that we do, or what we do, how's it going to impact them? And we all have different gifts, and we have to unpack those gifts. And one of those for me is tied to community, tied to mentorship, and tied to impact. And so that's I'm sort of living the dream.
There's a rumor in the community that when people hear your name and they talk about this celebrated surgeon of Dr. Johnson, that they may not actually be talking about you directly. Is there another Dr. Johnson that we need to know about?
It's interesting because, it's my wife, actually. I'm always the plus one. And I met my wife during Dr. Nathalie Johnson, actually during internship. Funny story how we met, and then I'll kind of get back to the things that she's done in the community. And since she's not here to correct my story of how we met, it's going to be my version. And I remember when I was a medical student at USC, and I saw her in a distance, and she passed me, and I spoke. I said, "Hello, how are you?" And she just shined me on. And she says she did speak to me. I don't recall that version. But then fast forward, when I became an intern, she was having a dinner party for a lot of the residents and students, and at her apartment, and she asked if I would come, and I go, "Oh yeah, that'd be great." And I asked, "Well, what day would that be?" And she said, "Oh, it's going to be Friday." And then so about an hour or so later, the call schedule came out, and I happened to unfortunately get called the Friday that this dinner party was supposed to happen. And so I paged her back and said, I can't make it. I'm on call. She goes, "It's actually Saturday." And so I go, and I was the only guest. So she, and so the rest is history. After that, we dated for a long period of time, and then ultimately got married. But the interesting thing about her, she's very, very passionate about cancer. She's a surgical oncology surgeon, and she is the reason why I came to Oregon, because I was originally going to stay in Boston, and we decided that instead of us being separate, that we wanted to come together and have a family. And where do we go? Do we go to the East Coast or do we come here? So I came here. She came here, I think, in 1992. And so with her focus on breast cancer, she travels all around the world and teaches and is the current medical director of the Legacy Cancer Institute. She does some amazing things. She's an Oregon history maker. She's the first African-American female president of the North Pacific Surgical Association. So yeah, she's the famous Dr. Johnson, and I'm just the eye candy or the plus one.
That's awesome. Now I'm going to remember, I'm sure she's going to see this and recall that eye candy comment. So we have to make sure that Dr. Johnson sees this and gets an opportunity to respond. But it's amazing that the two of you chosen professions that require so much of yourselves personally, but also give so much to others. How do you balance that from the family dynamic? How do you balance kind of working your schedules and giving so much to the community, but yet still finding time to recharge and to work with one another effectively?
That's an interesting question, and it's not easy. And sometimes, some people like to be as spontaneous as they can, but with us, sometimes we have to schedule a date, or we have to look at our schedules to make sure that there are times that we can actually be together. And as you can imagine, we are external quite a bit, and so when we have that opportunity to be home, that's when we are definitely home together, and we try to strike a balance there, because otherwise we can be out all the time. And we're both, and most people don't believe this, we're both sort of introverts, and so we recharge together from that perspective, and we feel that we are much stronger, and our bond is great when we are together, and we really do try to help each other and lean on each other. And I think it's worked out. But yes, our schedules are incredibly busy. But one of the things we try to do as we try to do things together. So, for example, if anyone ever saw us at a Trailblazer game, we are there together. That's something that when we forged that partnership, that was time that I didn't want to spend away from her. So we were always together from that perspective. So anything that we could do as a couple and as a family with our daughter and son, that's what we would do. So, but it hasn't been easy.
Yeah, it's amazing. And thank you for sharing that. I'm sure there are many that are listening to you describe that are trying to find that balance themselves of building a career or maintaining a career in leadership and trying to balance. It sounds like a key takeaway is it's okay to schedule the time if you have to.
Yeah.
Okay. Yeah. So you mentioned something as you were describing that, and it's you described yourself as an introvert. And so that's interesting, because as a leader of an organization and also being very public and engaged in the community, that doesn't seem to be in alignment with the personality that many people probably see. So one, how does being an introvert impact how you lead every day and how you engage? And are there things that you do that kind of help you as an introvert be more effective as a leader?
The interesting thing about that is oftentimes people think a lot of leaders are those who seek leadership are extroverts, and I would say probably 40% of individuals who lead companies or who lead initiatives are introverts. And one of the ways, the things that help me is I love reading. Another thing that helps me is I'm more of a reflective leader. And I think as an introvert, you are more reflective. You process things differently. You love to elicit feedback. And what I always say is I listen, and I like to respond versus react. And in the morning, I reflect on the day, and in the evening, I reflect on the day. And I recharge not around people, but sort of alone. But that being said, when in a crowd, or when asked to do something like this, or when asked to be a part of a larger group, I can do that just as easy as anyone else. But I recharge differently from what an extrovert would do.
So this COVID quarantining then might be an opportunity for Superman to really recharge, because even if you wanted to really be around a lot of people, you couldn't. So this is maybe a time for you to spend even more time recharging.
This has been, it's unfortunate that we're in the situation that we're in, but it has been a time where I've recharged quite a bit. I've reflected quite a bit. I've been able to read quite a bit, and I think it's also helped me grow, which I think is important. No matter how old you are, no matter how much you've accomplished, and no matter how much you think you will accomplish, you have to grow and try to be better each and every day.
So with that said, and thinking about growth and thinking about being an introvert, I imagine that you've had an opportunity to read a lot during this time. So maybe share with what you're reading now, and what types of things you enjoy reading.
The interesting thing about reading, and I shared my the ritual that I go through, and some people think is kind of crazy, but maybe it's my obsessive compulsive nature. So some people, when they read, they want the book. Others use a Kindle, and others use an audiobook. Well, one of the things that I do, I love hardback books, and so I'll purchase the hardback. I will download it on audio book, and I will also get it on Kindle. People say, "Well, that's insane," and I think it's because of my life and the pace. When we have better weather, when I'm able to go for a walk or run or in the gym, I can put the audiobook in. When I am at home and recharging, I break out the hardback cover because I love the smell of the pages. And when I'm traveling, I don't want to carry the big books, so I carry the Kindle and I stick it in my pocket. So it allows me to continue to read across three mediums. So that's sort of the quirky thing that I do. But interestingly, the books that I'm reading now. One is a book called Red Blanket, which is written by Dr. John Hart. And Dr. Hart actually was a resident at the county hospital. He was there when my wife was there, and he had graduated by the time I got there. But it brought me back to the days of the county and being an intern and being a resident. And so it was just more of a historical account of some of the interesting things that we actually had to endure as residents. And then another book that I'm reading, and this is the thicker novel, is Leadership in Turbulent Times, and that one's by Doris Kearns Goodwin, and it's really discussing, or it's an account of four presidents: Lincoln, Theodore Roosevelt, Franklin Roosevelt, and Lyndon B. Johnson, and if you recall, they were presidents from very, very turbulent times. And interestingly, Abraham Lincoln was also an introvert, and what qualities did they use to help get through that? And so those are the two things that are actually on my nightstand today. But I would probably say probably one of my most favorite books is Quiet, because it by Susan Cain, because it made me realize that, hey, wait a minute, I am an introvert and I can lead and I can do a lot of things, and it validated just sort of that internal aspect of who I am. And I would probably say my favorite author is John C. Maxwell. I really read a lot of his books, but that's sort of what's on my nightstand and how I engage in the literature.
And I'm sure that all of the book publishers and authors owe you a debt of gratitude for purchasing their books 3 times. And that is a wonderful thing. Your contribution to the writers, they must appreciate you for that quality. So leading through difficult times, that's a very relevant topic, of course. Are there any things that you would share with those that are listening, or with other leaders that you think are incredibly important right now for leaders to make sure that they're watching out for or paying attention to, particularly since there's so many divisive voices in our world right now, this is an opportunity for leaders to demonstrate um, and to inspire individuals. Any things you could maybe add or share?
I think in the times that we're in, I think what the most important thing that a leader can do is collaborate
Hmm.
and listen. And you got to listen to both sides. You have to then take that information and engage, then create a plan or create a process that can move us forward. And I think sometimes we're moving so fast and we're not really listening. We have an agenda and we push it forward, but you surround yourself with and work with incredibly bright, talented people, and collaboratively you can do just about anything. But I think what's most important is you have to listen. You have to take the time to listen and be as collaborative as possible, because you're right, we're in very divisive times, and I think collaboration can get us through it.
I want to pivot a little bit, Dr. Johnson, and talk a little Trailblazers. Um, Talk a little bit about the Moda Center and maybe how often you get there. You mentioned that you and your wife actually attend games. How often do you get to go to games?
The interesting thing about that is we probably go to 30 plus games a year, and that's a lot. But we've developed such a great relationship with the Portland Trailblazer organization, with the leadership team, with Chris McGowan, his family, with the players, and so we want to be there to show support, but also with the relationship with Moda and the Portland Trailblazers there as an ambassador from a corporate standpoint. And it is something that we thoroughly enjoy. And the interesting thing about the Moda Portland Trailblazer partnership, it was never about putting our name on their building. It was really always about collaboration. And I would believe we have one of the more unique NBA relationships. And it is truly not a transactional relationship. It is really a collaboration in how both organizations can have an impact in the community, and that's been the way it has been day one.
It's amazing that you share that partnership. It is unique, and I just remember as a broadcaster, many people know that I have been an analyst for some years now. I remember when the naming rights were being considered, and I remember Chris McGowan saying that they wanted the right partnership. It wasn't about, like you mentioned, transactional, but they wanted a really true partner. And it seems like that has happened between Moda and the Trailblazers, because there is so much alignment in the values of the organizations when it comes to community, when it comes to healthcare. So it seems to be a great match. Would you agree?
Oh yeah, absolutely. It's a phenomenal match. And as we've sort of walked through a lot, like right now, the Moda Center is closed, and so how do we walk through that pandemic? And as Moda has walked through various issues, we've stuck by each other, and we've worked together and continuing to move forward. So it's been a great relationship.
Okay, so I have to ask you, you got a great relationship, Chris and the players. So who's your favorite Trailblazer? Who are you looking for when you show up at the Blazer games?
That's actually a tough question to answer. And the reason why it's a tough question to answer is I would say I don't have a favorite Trailblazer as it relates to who has the best crossover dribble or who can shoot a three or make an assist. It's not their prowess on the court. It's really what they do and what they represent off the court. And so, for example, and many people know that I have a great relationship with Damian Lillard. We're, as he would describe it, we're family. And we've developed and cultivated that relationship since 2013. I have a great relationship with CJ. And that came with the connection with Dame, and a great relationship with Nurk. And we actually keep in contact with Trailblazers who've actually moved on to other teams, such as Al Aminu or Mo Harkless, So my wife and I have been sort of there to help them, not only them, but their wives and their fiancés and their families. And any way we can help provide mentorship or support in any way we can, we do, and we will. And so as Dame would say, it isn't about having a favorite trailblazer. It's about family, and that's that's probably why we're there a lot as well.
Those are great guys. It's really refreshing to be in a city where players are admired for as much as what they do off the court as what they do on.
Yes.
So I can appreciate that answer very much. And speaking of off the court, let's maybe go back to leadership a little bit. You are currently the chair of an organization called the Oregon Health Leadership Council. What's the background and purpose of that organization?
Well, the interesting thing is the Oregon Health Leadership Council is a collaborative organization that was actually sort of put together by healthcare leadership in the community and also the business community. And the original premise was, how can we improve outcomes? How can we reduce cost? And how can we work together to ultimately do that? So the unique thing about the Oregon Health Leadership Council is that it is a collaboration of 25 leaders in the community, and that's presidents and CEOs are leaders in hospital systems, primary care clinics, specialty clinics, community care organizations, the Oregon Medical Association, the OMA, the Oregon Association of Hospitals and Health Systems, and also in alignment with the Oregon Health Authority, and national and regional health plans. So you can think about these 25 leaders sitting around a table, and what I like to call is co-optation, right? Because we're in some ways competitors, but we're also cooperating with each other with one goal in mind. And one goal in mind is to improve the health and well-being of all Oregonians. Now, well, how do you do that? So I would say there are three things we focus on. We focus on the cost of healthcare, which is reformation. We focus on transformation, how is care delivered? And as you mentioned earlier, we're in this pandemic, and how we've been able to transform how healthcare is delivered, obviously not from a surgical perspective, but with telemedicine and telehealth. And then the innovation side of things is taking what's called the triple aim or the quadruple aim together, and then really ultimately moving the needle. And since 2008, it has done wonders in the community. And so it's an honor to be a part of that organization. And it's also an honor to be able to co-chair it for the number of years that I've been able to do that.
So Dr. Johnson, with that is wonderful. And it sounds like an incredible organization. Are the general public able to see the findings or the results of your work from the Leadership Council? Is that information that's readily available?
Yes, you can go to the Oregon Health Leadership Council, the website, if you just plug it in, and it has all the individuals who are on the council. It has all the initiatives that we're currently working on. And it also has what we're thinking about strategically in the future and the history of the organization. So it's readily available and it's very transparent.
Excellent. That sounds like something that people should definitely take a look at and check out. So thank you for sharing that. If as a leader and a physician, a surgeon, you can impact change, how can business help with those initiatives? Are there things that businesses can do to participate in some of the things that you just mentioned?
Well, the interesting thing is they're very much so a part of the Oregon Health Leadership Council, and actually we're aligned with the OBC, which is a part of this as well. So they're very much so engaged in how we could improve the health and well-being of the community. And then businesses obviously can have great programs, wellness programs, and things like that can have a significant impact. But again, I believe the main way we do that is working collaboratively and collectively with not only the healthcare community, but the business community and government to really move the needle on how we can actually drive down costs, improve outcomes, and improve people's experience as they navigate that healthcare ecosystem.
So the more people at the table having conversations and working toward the common goal, then the better the result.
Absolutely, absolutely.
So one of the things that I'm really curious about, and I hope this isn't too technical, but there's been a move over the last maybe decade or so to wellness, and an organization speaking more about wellness and preventative care than they are about actual care directly or direct care. Does wellness really impact or drive down the cost of healthcare? Is there any correlation there?
You know, it sort of depends on how one defines wellness. You know, wellness is a way that we could be proactive about our total health, right? Our overall health in terms of choices we make and exercising every day and the food we eat. But to answer your question directly, absolutely, wellness can drive down the cost of healthcare. And the reason why it can drive down the cost of healthcare is if we focus on wellness, it's more preventative. So then, therefore, you're not going into the doctor's office to deal with chronic illness or other things. But I think wellness has to be thought of even more broadly. There's emotional wellness, there's environmental wellness, there's financial wellness, occupational wellness, social wellness, and mental wellness. All of those things, if they're out of line or out of balance, leads to stress. And that stress leads to hypertension. It leads to exacerbation of chronic conditions if you're diabetic. And so when we think about wellness, you have to really approach it holistically. And you know, one of the things that we've been talking about for at least half a decade is this notion of determinants of health. Mm-hmm. And determinants of health is directly related to overall wellness and well-being, and those things can have a significant impact on outcomes. So you may go to the best doctor in the world, you may go to the best hospital in the world, but you still have not overcome the issues that you have with various chronic conditions because of transportation insecurity or housing insecurity, other financial insecurity, education insecurity. All those things have a significant impact on overall outcomes. So I look at wellness as a more holistic approach or definition. But to answer your question, it absolutely makes a difference.
From a wellness perspective, then, if it makes the difference and has that much impact, then individuals should then take initiative, it sounds like, to be responsible or participate in their own wellness, particularly with those social determinants. Just being aware and being cognizant of those sorts of things can help you have a healthier life, in essence.
Right, and not only having the individual be held accountable, but have communities be there for support as well. And whether it's resources, whether it's providing transportation, whether it's having activity centers, whether it's job training, whatever it happens to be, in order for you to have a significant impact on that, it requires what I call a hub. And that hub is the community and connecting all those things together such that we can really move the needle on wellness.
I knew that the impact of community on all of these types of outcomes was significant. And I appreciate you affirming and validating that ideology. So I appreciate that. Speaking of outcomes and thinking about communities, we are living in an epoch of time where social unrest, social justice is at the forefront. And if you don't mind me asking you, Dr. Johnson, from a personal perspective, how do you weave equity into your work and into your own life?
You know, the interesting thing about social justice, it's really a very simple concept, right? And the concept is making sure that people, individuals, have a home, they have access to health, they have the benefits of employment, the benefits of education, and all other types of opportunities that will allow you to live a reasonable, normal life. And whenever anyone or any individual, knowingly or unknowingly, or intentionally or unintentionally, denies access to those things, there is this notion of injustice. And I think we're seeing that sort of play out today. And regardless of your political views, regardless of your socioeconomic status or gender identification or gender preference or race, you should have access to those things. And if we're able to understand that, own it, and remove some of our biases, then you can actually move the needle on this whole notion of social injustice. And to get back to your question of how it, if you think about that, obviously the population that I talked about is tied to diversity, equity, and inclusion, because that's really what that is. And I will talk from a work perspective. Here, we have diversity, equity, and inclusion ensconced in our company. We have a committee, a board committee that's focused on diversity, equity, and inclusion. We have a vice president of diversity, equity, and inclusion in community initiatives. So from a work perspective, we're always thinking about that moving forward in all the things that we do. From a personal perspective, it's very clear and passionate initiative that my wife and I and our family focus on. One of the things that we had the opportunity to do is, OHSU approached us to think about this notion of health equity. And so when you think about health equity, well, there's a thing called unconscious bias or implicit bias that occurs in the healthcare system. And again, it's not intentional, it's unintentional. And we all have them. And so one of the things we wanted to do is not focus on just having a lecture at the university where people can come and have an engagement there. We really wanted to put it in the community because that's where it belongs. And so we help endow the Unthank lecture. And we chose Unthank, Dr. DeNovo Unthank, which is actually one of the, I think he was the second physician of color in the state of Oregon. And we thought it would be much better if we named the lectureship after him. And he was really a pioneer because he took care of all communities of color, not just the African-American community. And so with that, we had a huge lecture at the Maranatha. And one of the interesting things about that is when you looked out at the sea of people, it was incredibly diverse. And that's really what we want, the impact that we wanted to have. And it was all about health equity. It was all about how can we actually collaborate and come together and move the needle. And we have a meeting coming up in the next couple of weeks to say, okay, what are we going to do next? Because that's something that's very, very passionate that we focus on. And another area that we've focused on is the Trailblazer Foundation and their Racial Injustice Fund. That's something that we've supported quite a bit. So when we think about social justice, when we think about diversity, equity, and inclusion, from a work perspective, from a personal perspective, it's something I think about and live, breathe, and every day.
It's important. The takeaway that I hear is it's not a tack-on exercise. It is woven. It is in the fabric of who you are as an individual and also how you engage from the leadership position and how the organization Moda shows up in the community. That's phenomenal to hear. Thank you for all you do in that regard. And I will add that Dr. Unthank, which now that park, he has a park named after him here in Portland as well, is now the site of the Center for Self-Enhancement. So he has definitely made an impact. And I actually grew up just one block away from Dr. Unthank Park. So I know him well. And of course, the connection with University of Oregon, I can't pass that up or take it up. So with what you described with healthcare and outcomes, what are the things that you do? I've heard that you could be considered a gym rat. And so how do you stay healthy during these times?
You know, I used to really be a big weightlifter and exercise quite a bit. I still do exercise quite a bit. I think it's important from a dietary perspective. So I definitely watch my carb count. I remember once I was in the elevator and I would bring my lunch to the office every day. And Robert Godey, our CEO, he would look at me and he'd look at my lunch bag and he said, "I bet you know exactly how many calories is in that box." And I say, I do. So one of the things I do is definitely watch what I eat. And I don't believe in eliminating things from your diet. I just think you have to you have to eat within moderation, right? That's really what you have to do. You can eat just about anything, but don't overdo it. And exercise is critically important. I do a lot of cardio every day, and I still lift a little bit every day. An interesting, funny story. I was working with one of the Portland Trailblazer strength and conditioning coaches, and I thought, oh, I can work out with him. Give me a program. And oh my God, I thought I was going to die. So clearly, I'm not at that level, but I do think it's important to watch what you eat and exercise every day. From a cardiovascular standpoint, that's critical.
I would agree with that. I don't necessarily get to exercise every day. That's commendable, but considering that you're Superman and that's your nickname, I wouldn't expect anything less. So that's wonderful, wonderful to hear. There's one of the things that has come up regarding a question from our audience that I think is appropriate. Now, we normally don't take questions directly, but this one has to do with leadership. And so when the question is around, when so many people invited to the table as a leader, how do you effectively lead and impact change without having groupthink take part in that leadership decision?
Well, that's very difficult. But I think when you groupthink takes over, when you are not managing the conversations. And oftentimes groupthink is led by 2 or 3 people, right? So if you have a room of 10 people, and 3 people are, if you have a room of 10 people and 3 people are doing the bulk of the talking and the other 7 aren't really, then all of a sudden groupthink takes over. So one of the things I try to do is I'll notice if people are not contributing, and I will ask them, well, what's your opinion on that? How do you feel about that initiative in there? Is there any thought or something that you would want to do differently? And once you do that and you draw that out, you then all of a sudden create a dialogue, and now you can get on the whiteboard and you can really move the needle again as it relates to collaboration. Because, and I know this notion of groupthink, and then you say, okay, now what do you do? Let's say if you have a group of healthcare leaders. Okay, now you take that once you have those healthcare leaders and coming up with an idea, then you have the business community come up with an idea, and then together you could move forward. And that's why that group is so diverse. But what's most important is that everyone actually has a voice, and you have to lead by allowing people to have that voice, because in that room, as we know, 4 of those 10 people will be introverts, and they will most likely not say anything. So you do have to draw those people out.
Everyone has a voice. That is exceptional. Would agree. And then also just having the knowledge, that stat, I was not aware of that stat about introverts. That's a great tool to have impact in future meetings that we all have. Well, Dr. Johnson, Superman, it is absolutely a pleasure to have spent some time with you this morning. I just want to thank you for your commitment to the community and the leadership that you provided for Moda Health and all of the other organizations that you serve with. Thank you so much for your time this morning. It's been an absolute pleasure.
Well, thank you. It has been an absolute honor, and I am a big fan of yours, and I really appreciate the opportunity to share. And thank you for thinking of me.
Absolutely a pleasure. Well, everyone, thank you for participating with us this morning on Community Conversations. And hopefully there are some takeaways that you can take back to your organizations that will make Oregon a better place. Thank you all, and we'll see you next time.